Hey everyone, welcome back for another deep dive. Today we're tackling something pretty intense.
Intense is a good word for it.
Yeah, we're looking into necrotizing fasciitis.
Ah, yes.
Most people probably know it as the flesh-eating disease,
Right.
and I guess that's a pretty accurate nickname for this one.
Yeah, that one's pretty spot on.
So we've got some research lined up, and a particularly interesting story about a woman named Sue who had to deal with this.
Yeah, Sue's case is a really good illustration of how quickly this thing can go from seemingly nothing to very, very serious.
Right, and that's what I think is so fascinating about necrotizing fasciitis,
Yeah.
or NF for short.
Enough, yeah.
Is that it can start with an injury so minor that
Right.
you would normally never even think twice about it.
Yeah, you just completely ignore it.
Right, you just be like, whatever, and then all of a sudden you're fighting for your life.
Exactly.
And Sue's story is a perfect example of that.
Yeah.
So picture this. You're rinsing out a crab tin. You get a tiny cut on your finger, slap a Band-Aid on, and think absolutely nothing of it.
Right.
That's exactly what happened to Sue.
Yeah, a small cut, about a centimeter long.
Small,
Healed up completely fine.
healed right up,
No problem.
no problem.
But then about 2 weeks later, things took a very scary turn.
Oh, man. I'm already getting nervous just hearing this.
It's understandable. This is a scary one. And like I said, it can progress incredibly fast.
Yeah.
In Sue's case, it began with what she thought was a pulled muscle in her shoulder.
Wait, so hold on. A pulled muscle.
Yeah.
How does a cut on your finger lead to shoulder pain?
Well, that's what's so sneaky about NF. It's a bacterial infection that attacks the fascia.
The fascia.
Yeah, which
Yeah.
is a layer of tissue underneath the skin that kind of connects muscles and organs
Throughout your body.
throughout the body, so it's all connected.
It is all connected.
So even though the cut on her finger healed up on the surface,
Uh-huh.
the bacteria had already gotten in there.
Right, they were already doing their thing.
And were wreaking havoc deeper down. Exactly, and that's why the pain with NF is so deep and intense.
Deeper than a normal cut.
It's not just on the surface.
Well, yeah.
In Sue's case, that soreness in her shoulder that she thought was just a pulled muscle quickly escalated to chills, vomiting, and pain so severe that she actually thought she was having a heart attack.
Oh, wow.
Yeah.
Okay, so red flag number one,
Red flag number one.
pain seems way too intense
Way too intense.
for such a minor injury.
Yeah.
What other signs should people be looking out for?
We have to keep in mind that NF often looks like other less serious conditions in the early stages.
Oh, so it can be hard to diagnose.
Yeah, that's one of the tricky things about
It's
it.
tricky.
Along with that severe pain that we were talking about, you might see swelling, redness, and maybe even some blisters
Around the injury.
around the injury site. Yeah.
Yeah.
And the skin might look shiny and kind of stretched out.
Oh,
And sometimes it can even start to weep fluid.
weep fluid, that sounds
It's not great.
just...
Yeah, it's a sign that the tissue underneath the skin is basically being dissolved by the bacteria.
Oh.
And unfortunately for Sue, things progressed exactly like that.
Oh, no.
By the next morning, her entire right arm was black and bruised with fluid seeping from her skin.
That is a horrifying image.
Yeah, it's pretty gruesome.
So what happened next? Did the doctors immediately recognize it as NF when she went in?
Sadly, no.
No.
At first, they thought it was cellulitis, which is a much less serious skin infection.
Oh.
And that's a really important point because
Yeah.
it shows why it's so crucial to know the specific signs of NNF.
Right.
That misdiagnosis cost Sue precious time.
So she was sent home with the wrong treatment.
Right.
And what happened next?
Well, sending her home with the wrong treatment meant the infection had more time to spread.
Oh, no, this is where I imagine things get even more intense.
Yeah, you're not wrong about that. It spread, and it spread fast.
Hmm.
It wasn't until her skin actually started turning black that the doctors finally realized she was dealing with something much more serious.
Oh, gosh, it's terrifying how quickly this infection can take hold.
It really is.
So at this point, Sue's back in the hospital. They finally figured out it's NF. What happens next?
Well, she was rushed straight into emergency surgery to remove the infected tissue.
Wow.
See, the bacteria release toxins that basically dissolve the fascia.
Dissolve it?
Yeah, and if it reaches vital organs, it can be fatal.
So it's a race against time.
Absolutely.
So surgery is the only way to stop it?
It's a crucial part of the treatment, along with powerful antibiotics to kill the bacteria.
Okay, so surgery and antibiotics.
Right.
But even with that, even with aggressive treatment,
Unfortunately, NF has a pretty high mortality rate.
how high are we talking?
Up to 30% of patients don't survive.
30%. So 1 in 3 people don't make it.
Yeah, those are tough odds.
So Sue's facing surgery, powerful antibiotics, and a 1 in 3 chance of not making it.
It was a very, very serious situation.
I mean, that's where I think I would just lose all hope.
It's understandable, but Sue's a fighter. And even though she had the odds stacked against her, she slowly started to recover.
That's incredible. It's amazing what the human body can overcome.
It really is. And of course, the skill of her medical team can't be overlooked.
Right. Shout out to the medical professionals.
Absolutely. But I do want to emphasize that her recovery was not easy.
I can imagine.
It was a long and difficult journey.
What did she have to go through?
Well, she had to learn to walk again, and she still has lasting effects from the infection even now.
Like what kind of long-term impacts can this have?
Well, it varies from person to person, but nerve damage is pretty common.
Nerve damage.
Yeah, which can lead to loss of sensation or weakness in the affected area.
Oh, wow.
Some people need multiple surgeries or skin grafts.
Multiple surgery.
Yeah, and there's often a significant psychological impact as well.
Right, of course. I mean, going through something like that would leave anyone with emotional scars.
Absolutely.
So Sue's story is definitely a stark reminder of how serious NF is.
It really is.
But you mentioned earlier that cases seem to be on the rise.
Yeah.
Particularly since the pandemic. Why is that happening?
Well, that's one of the big questions researchers are trying to figure out.
Huh?
There are a few theories out there, and it's probably a combination of factors.
Okay.
One thought is that lockdowns and social distancing, while important for preventing the spread of COVID,
Right.
may have sort of inadvertently weakened our immune systems a bit.
How so?
Well, our immune systems need to be exposed to germs regularly to stay strong.
Kind of like an exercise routine.
Exactly. By limiting contact with others, we reduced our exposure to a whole range of different pathogens,
Including common ones.
including common ones like Strep A.
Strep A, you mean the bacteria that causes strep throat?
Exactly. It's incredibly common. Most people carry it without even knowing it.
Uh-huh.
But it's also one of the bacteria that can lead to NF if it gets into the body through a wound.
Hold on. So you're telling me something as simple as strep throat can turn into this horrific flesh-eating disease?
It's not that straightforward. But it does highlight the fact that even harmless bugs can become really dangerous under the right circumstances.
Right.
And that's where the weakened immune system theory comes in.
Uh-huh.
If our bodies haven't encountered these bugs in a while, our immune response may not be as effective.
So our bodies sort of forget how to fight them off.
In a way, yes.
That's kind of scary to think about.
Yeah,
But couldn't there be other factors at play as well?
of course. It's likely a multifactorial situation. Researchers at Sheffield teaching hospitals, for example, they've noticed an increase in cases, and they think that a more aggressive strain of Strep A might be circulating.
A more aggressive strain.
Yeah,
So it's even stronger than the regular strep A.
potentially, yes.
Oh, man.
More research is needed to confirm this, but it's definitely a possibility.
So we've got potentially weakened immune systems and potentially a more aggressive strain of bacteria.
It's not a great combination.
No, it's not. That's pretty worrying.
And that's why awareness is so important.
Right.
Knowing the signs and symptoms of NF can literally save your life.
Okay, so let's talk about those symptoms.
Yeah.
You mentioned pain that's out of proportion to the injury.
Right.
What else should people be looking out for?
Well, think of it this way. If you have a wound that's just not healing as expected and the pain is getting worse instead of better, that's a red flag.
Okay.
Along with the pain, look for any swelling, redness, or changes in skin color around the wound.
So if the skin starts turning black or purple,
That's a sign to get to a hospital immediately.
immediately.
Don't wait.
And what if you have other symptoms like fever or chills?
Same thing if you're experiencing fever, chills, vomiting, diarrhea, especially along with a wound that's not healing properly.
Get to the ER.
Yes,
It's better to be safe than sorry.
absolutely. Early diagnosis is key. The sooner treatment begins, the better your chances of survival and minimizing any long-term complications.
Okay, so let's say someone suspects they might have NF.
Okay.
They rush to the ER. What happens next?
Well, the medical team will want to move quickly. They'll assess your symptoms, examine the wound, and they'll probably order some blood tests and imaging scans to confirm the diagnosis.
To see what's going on.
Right, and to figure out how far the infection has spread.
And then comes the surgery and antibiotics.
Exactly. Treatment for NF is aggressive, and it often involves a whole team of specialists working together.
Wow.
It's a serious condition.
All this talk about surgery and antibiotics makes me realize how vulnerable we are to these kinds of infections.
We are.
It's unsettling to think that anyone could be at risk.
You're right, it is unsettling. And it raises a really important question. Why do some people develop NF while others with similar injuries don't?
Yeah, that's what I've been wondering this whole time. What makes someone more susceptible to this infection? It just seems so random. One person gets a minor cut, it heals without a problem,
Right.
and then someone else ends up battling for their life with NF?
It's a really good question.
What is it that makes some people more vulnerable
Yeah, why some people and not others?
to this terrifying infection?
Well, there's no easy answer, unfortunately.
Yeah.
It really seems to be like a perfect storm of factors,
Look.
But we do know that certain things can increase your risk,
Okay, so let's talk about those risk factors.
right?
Who's most vulnerable to developing NF?
Well, people with weakened immune systems are definitely at higher risk.
Okay, so that makes sense.
Yeah.
So if you have like diabetes or high blood pressure
Right, those kinds of things.
or any autoimmune disorders,
Right.
you really need to be extra vigilant
Absolutely.
about wound care and those early warning signs.
Be very, very careful. And people who are taking medications that suppress the immune system,
Like steroids.
like steroids, for example,
Right.
they're also more susceptible.
Right, because it's suppressing your immune system.
Exactly.
And age plays a role too, right?
Yeah, older adults tend to have weaker immune systems as well.
That makes sense.
So those are some of the big ones.
What about lifestyle factors?
Oh, yeah.
Like smoking or drinking alcohol?
Those definitely play a role too.
Does that increase your risk?
Yeah, smoking weakens your immune system
Okay.
and it impairs circulation,
Right.
which is really important for wound healing.
So it makes it harder for wounds to heal.
Exactly.
And what about alcohol?
Well, excessive alcohol use also suppresses the immune system
Okay.
and it can damage your liver,
Right.
which makes it harder for your body to fight off infections in general.
Wow. So maintaining a healthy lifestyle is important for so many reasons.
It really is.
And it seems like protecting yourself from NF is another one to add to the list.
Definitely. It's all about supporting those natural defenses,
Right.
But even in perfectly healthy people, there's still this sort of mystery around why some get NF and others don't.
Yeah, it almost makes you want to live in a bubble.
Right.
But seriously, knowing that there's no foolproof way to prevent this
There's no guarantees.
really makes it even more crucial to recognize those symptoms early on.
You've got to catch it early. That's the key. So let's just recap those red flags one more time.
Okay.
Severe pain,
Out of proportion.
way out of proportion to the injury,
Swelling,
swelling redness,
changes in skin color,
right? Any changes in skin color at all.
fever,
Fever, chills,
vomiting,
diarrhea.
all those lovely things.
Yeah, all those lovely things.
If you have any of those, especially with a wound,
Get to a doctor.
get to the doctor immediately.
Don't mess around.
Don't mess around.
Better safe than sorry.
Always better to err on the side of caution.
Absolutely.
Don't be afraid to advocate for yourself
Right.
and seek medical attention if something feels off.
Trust your gut.
Trust your gut.
You know your body best.
So we've covered a lot of ground today.
We have.
We learned about the scary nature of NF Day,
It's a scary one for sure.
the things that increase your risk,
Uh-huh.
the warning signs, and why early intervention is so important.
Early intervention is key.
It's been an intense deep dive.
Intense but important.
Yeah, I think it's empowering to have this knowledge.
I agree.
The more you know about NF, the better equipped you are to protect yourself.
And your loved ones.
Right.
Knowledge is power.
I'm leaving this deep dive feeling a lot more informed,
That's great to hear.
but also with a newfound appreciation
Right.
for the simple act of washing a cut.
Don't underestimate the power of basic hygiene.
It's the little things sometimes.
It really is.
Well, big thanks to you for walking us through this complex
You're welcome.
and pretty scary topic.
It's a tough one, but it's important to talk about.
I learned a lot.
Me too.
And for our listeners, if you'd like to learn more about NF,
Right.
we encourage you to check out the resources in the show notes.
Yeah, there's some great information out there.
You can find more from reputable sources,
Like the CDC,
the CDC,
the Mayo Clinic.
all those good folks.
Lots of good info out there.
And as always, if you have any concerns about your health,
Right.
don't hesitate to reach out to a medical professional.
Absolutely.